67 years old and suddenly no ejaculate after intimacy. Is this the beginning of prostate cancer? That's the question one of my patients asked me last week, his voice trembling with worry. And honestly, I see this fear in my clinic every single day. I'm Dr. Amelia Wright, and I've been a urologist here in London for over 25 years. And today I'm going to give you the straight answers about masturbation, ejaculation, and prostate health that most people are too embarrassed to ask about. Let me be absolutely clear with you. Prostate problems are real, and most of us avoid talking about them. It's the British way, isn't it? Stiff upper lip and all that. But here's the thing, by making just a few small changes in your daily habits, you can relieve pressure on your prostate and start enjoying a full night's restorative sleep again. No more getting up 3, 4, 5 times to use the loo. No more lying awake, wondering if something's seriously wrong down there. Now, before we dive in, I want you to understand something important. In the next 8 minutes or so, you'll learn exactly why ejaculate can disappear after sex or masturbation, how many times per week is actually beneficial for your prostate, and 3 warning signs that mean you absolutely must see a doctor straight away. So stick with me, because this information could genuinely change your life. Right, let's address the elephant in the room. That question from my 67-year-old patient about losing his ejaculate. This is what we call retrograde ejaculation, and it's far more common than you'd think, especially in older gentlemen. What happens is this. Normally, when you climax, a small muscle closes off the entrance to your bladder, forcing the semen to exit through the penis. But sometimes, particularly as we age, or if we're taking certain medications for blood pressure or prostate issues, that muscle doesn't close properly. The semen takes the path of least resistance and goes backwards into the bladder instead of out through the urethra. Now here's what I tell my patients. This isn't dangerous. It's not cancer. It's not going to harm you. Your bladder simply flushes it out the next time you urinate, and you might notice your urine looks a bit cloudy. That's perfectly normal. The thing is, it can be quite distressing psychologically. You feel like something's wrong, like you're broken somehow. But medically speaking, if you're not trying to father children, retrograde ejaculation is more of a nuisance than a serious health concern. However, and this is crucial, if you suddenly experience a complete loss of ejaculate, especially if it's accompanied by pain, blood in your urine, or difficulty urinating, you need to see your GP or a urologist immediately. These could be signs of something more serious, like prostate enlargement, infection, or, yes, in rare cases, cancer. Don't mess about with these symptoms. We British love to soldier on, but when it comes to your prostate, early detection is absolutely vital. Now let's talk about what you're all really wondering about. Does masturbation actually protect your prostate, or does it damage it? I've heard every myth under the sun in my 25 years of practice. Some blokes think it'll make them go blind. Others reckon it'll give them cancer, and plenty worry they're doing it too much, and it's wearing things out. Let me give you the scientific facts, straight from the research. A study from Harvard University, one of the most comprehensive we have, followed thousands of men for decades. The results surprised even the medical community. Men who ejaculated 21 times per month, that's roughly 5 times a week, had a significantly lower risk of developing prostate cancer compared to those who ejaculated less frequently. We're talking about a reduction of around 20 to 30% in cancer risk. That's enormous. And it's not just one study saying this. Multiple research projects across different countries have found similar results. The mechanism is actually quite logical when you think about it. Your prostate produces fluid that makes up a large part of your semen. If that fluid sits there for long periods without being released, it can become a breeding ground for inflammation and potentially cancerous changes. Regular ejaculation, whether through sex or masturbation, flushes out the prostate, keeps things moving, and reduces inflammation. Think of it like a water pipe in your house. If you never run the tap, the water becomes stagnant, bacteria can grow, and you end up with problems. But if you run it regularly, everything stays fresh and clean. Your prostate works in much the same way. Now, I know what some of you are thinking. 21 times a month? That's quite a lot, especially if you're older or don't have a partner. And here's where I need to be realistic with you. That's the optimal number from the research, but doing less doesn't mean you're doomed to cancer. What the research shows is a correlation, not a hard and fast rule. The key point is regular ejaculation, whatever that means for you individually, appears to be beneficial for prostate health. Let me tell you about one of my patients, a gentleman named Robert, who came to see me absolutely terrified. He was 65, recently widowed, and hadn't been sexually active in over a year. He'd read something online about prostate cancer risk and was convinced he was going to die. We had a long chat, did some tests, and I explained to him that whilst regular ejaculation is beneficial, there are many other factors that affect prostate health: diet, exercise, genetics, and overall lifestyle. Robert started taking better care of himself. He began walking every day, improved his diet, and yes, he started masturbating regularly again, something he'd felt guilty about after his wife passed. When he came back for his follow-up 6 months later, not only were his PSA levels perfectly healthy, but he looked 10 years younger. He was sleeping better, feeling more energetic, and had even started dating someone new. He told me, "Dr. Wright, I wish I'd had this conversation with a doctor 20 years ago." Now let's break this down by age, because what's appropriate and beneficial changes as you get older. If you're in your 30s or 40s, your body's testosterone levels are still relatively high, and regular sexual activity or masturbation, say 3 to 5 times a week, is perfectly healthy and normal. This is when you're at your peak, and it's actually harder to go without regular release. Your body's designed for this level of activity. When you hit your 50s and 60s, things start to change. Testosterone levels naturally decline, and you might not feel the urge as frequently. And that's completely normal. Don't compare yourself to your younger self or to what you think other men are doing. What matters now is quality over quantity. Twice a week, 3 times a week, whatever feels right for your body. The key is consistency and listening to what your body's telling you. For those of you over 70, and I have plenty of patients in their 70s and 80s who are still sexually active, good on you. Keep going as long as it's comfortable and enjoyable. The benefits don't stop just because you've got a few more grey hairs. However, this is when we need to be more vigilant about warning signs. At this age, regular checkups become absolutely essential. Speaking of warning signs, let me give you 3 that should send you straight to your doctor. First, if you're experiencing pain during or after ejaculation. This isn't normal at any age and could indicate infection, inflammation, or other issues that need treatment. Don't just take paracetamol and hope it goes away. Second, if you're seeing blood in your semen or urine, I cannot stress this enough. Blood where it shouldn't be is always a red flag. It might be something relatively minor, like a small infection, but it could also be something more serious. Better to check and be told it's nothing than to ignore it and regret it later. Third, if you're having increasing difficulty starting urination, maintaining a steady stream, or you're getting up more than twice a night to use the toilet. These are classic signs of prostate enlargement, which is incredibly common as men age, but needs to be monitored by a professional. Left unchecked, it can lead to more serious complications like bladder damage or kidney problems. Now, let's talk about some lifestyle changes that can support your prostate health alongside regular ejaculation. Diet plays a massive role that most people don't appreciate. Tomatoes, for instance, are brilliant for prostate health because they contain lycopene, a powerful antioxidant. Have a nice plate of pasta with tomato sauce a few times a week. Fish, particularly fatty fish like salmon and mackerel, provide omega-3 fatty acids that reduce inflammation throughout your body, including your prostate. Cut down on red meat and dairy if you're eating them every day. I'm not saying you can never have a Sunday roast or a cup of tea with milk. I'm British too, and I understand, but moderation is key. Studies have shown that men who consume large amounts of dairy and red meat have higher rates of prostate problems. Alcohol is another consideration. A pint down the pub with your mates is fine, even beneficial for your mental health and social connections. But if you're drinking heavily every night, that's going to cause inflammation throughout your body and put stress on your prostate. Same goes for smoking. If you're still smoking in this day and age, now's the time to pack it in. Smoking increases your risk of aggressive prostate cancer significantly. Exercise is absolutely crucial as well. You don't need to join a gym or start running marathons. A brisk 30-minute walk every day does wonders. It improves blood circulation, helps maintain a healthy weight, and reduces inflammation. Some of my patients have found that pelvic floor exercises, not just for women despite what you might think, can help with urinary symptoms and even improve sexual function. Here's something else I discuss with my patients that often surprises them. Stress and mental health directly impact your prostate. When you're chronically stressed, your body produces cortisol and other stress hormones that cause inflammation throughout your system. I've seen men whose prostate symptoms improved dramatically once they retired from stressful jobs or started managing their anxiety better. Which brings me to an important point about the psychological side of all this. Many of my older patients feel embarrassed or ashamed about still having sexual desires or masturbating. Society tells us that older people, especially older men, shouldn't be interested in sex anymore. That's absolute rubbish. Sexual desire and activity are completely normal and healthy at any age. There's no cutoff point where you're supposed to just stop being a sexual being. I had a patient once, must have been in his mid-70s, who was so embarrassed about asking for help with erectile dysfunction that he'd been suffering in silence for 2 years. When we finally had a proper conversation, we got him sorted with treatment, and his quality of life improved immensely. He told me his only regret was not speaking up sooner. The shame and stigma around these topics need to end. Your prostate health is as important as your heart health, your lung health, or any other aspect of your well-being. If you wouldn't feel embarrassed telling your doctor about chest pain, you shouldn't feel embarrassed discussing problems with urination, ejaculation, or sexual function. Let me address one more common concern I hear. What about excessive masturbation? Can you do it too much? The honest answer is that it's very difficult to damage yourself through masturbation alone. Your body has built-in safeguards. If you're overdoing it, you'll experience soreness or temporary inability to achieve an erection, and you'll naturally take a break. What I worry about more is when masturbation starts interfering with your daily life, your relationships, or becomes compulsive to the point where you're doing it instead of engaging in other important activities. That's more of a psychological concern than a physical one, and it's worth discussing with a healthcare professional. Right, let's talk about supplements and alternative treatments, because I know many of you have seen adverts for various products claiming to improve prostate health. Saw palmetto is probably the most common one. The research on saw palmetto is mixed. Some studies show modest benefits for urinary symptoms, others show no benefit at all. It's generally safe, so if you want to try it, go ahead, but don't expect miracles. Same goes for zinc, selenium, and vitamin E supplements. There's no strong evidence they prevent prostate cancer, despite what the marketing might suggest. What does work, and there's solid research behind this, is maintaining healthy vitamin D levels. We don't get enough sun here in Britain, particularly in winter, and many of us are vitamin D deficient. Talk to your GP about checking your levels and possibly taking a supplement. This is beneficial not just for your prostate, but for your overall health. Green tea is another one that has some legitimate research backing it up. Men who drink green tea regularly appear to have lower rates of prostate problems. I'm not talking about the occasional cuppa with biscuits, but several cups throughout the day. If you can't stand green tea, there are extracts available, but as with everything, speak to your doctor first, especially if you're on other medications. Now, I want to address something that comes up in the comments and questions I receive quite frequently. What about frequency of ejaculation and fertility? Some men worry that frequent ejaculation will lower their sperm count. Here's the thing. If you're past 60, you're probably not trying to father children anyway, so this becomes a non-issue. But even for younger men, whilst it's true that abstaining for a few days before trying to conceive can increase sperm concentration, the overall impact on fertility from regular masturbation is minimal. Your body is constantly producing new sperm, and unless you're literally ejaculating multiple times every single day, you're not going to deplete your reserves in any meaningful way. What about prostate massage? This is something that's gained popularity in recent years, particularly in alternative health circles. The theory is that massaging the prostate can improve health by reducing inflammation and improving fluid drainage. There is some evidence that it can help with chronic prostatitis, a condition involving persistent inflammation and pain. However, it's not something you should attempt on your own without proper instruction, and it's definitely not a replacement for regular medical care. If you're interested in this, discuss it with a urologist who can show you the proper technique or recommend a trained therapist. I need to spend a moment on PSA testing because this confuses a lot of people. PSA stands for prostate-specific antigen, and it's a protein produced by your prostate. Elevated PSA levels can indicate prostate cancer, but they can also be elevated due to benign prostate enlargement, infection, or even recent ejaculation. This is why doctors don't just rely on PSA numbers alone. We look at trends over time. We do physical examinations, and if necessary, we perform biopsies. In the UK, there isn't routine PSA screening for all men like there is in some countries. The reason is that PSA testing can lead to overdiagnosis and overtreatment of slow-growing cancers that might never have caused problems. However, if you're over 50 or over 45 if you're of African or Caribbean descent or have a family history of prostate cancer, it's worth discussing PSA testing with your GP. It's a simple blood test, and whilst it's not perfect, it's one of the best tools we have for early detection. Let me share another patient story that illustrates why these conversations are so important. I had a gentleman, call him James, who came in with his wife. She'd practically dragged him to the appointment because he'd been getting up 6 or 7 times a night to urinate, and she was worried. James insisted it was just part of getting older, nothing to fuss about. When I examined him and ran some tests, we found his prostate was significantly enlarged and his PSA was elevated. We caught it early enough that treatment was straightforward, and he's doing brilliantly now. But if he'd continued ignoring the symptoms for another year or two, the outcome might have been very different. The lesson there is simple. Listen to your body and listen to your loved ones when they express concern. Men, particularly British men, tend to minimize health problems and avoid seeking help until things are really bad. Don't be that person. Your health matters, and early intervention almost always leads to better outcomes. Now, what about the connection between prostate health and overall sexual health? They're intimately linked, pardon the pun. A healthy prostate contributes to healthy sexual function, and conversely, maintaining sexual activity helps keep your prostate healthy. It's a positive feedback loop. When men develop prostate problems, particularly after surgery or radiation for cancer, sexual function can be affected. This is something we always discuss before treatment, and there are many options available to help maintain or restore function afterward. I want to emphasize that prostate cancer treatment has come a long way in the 25 years I've been practicing. We have much better techniques now that minimize side effects and preserve quality of life. nerve-sparing surgery, precision radiation, active surveillance for slow-growing tumors. The old days of every prostate cancer diagnosis leading to devastating side effects are largely behind us, though of course every treatment carries some risks. Right, let's wrap this up with some practical takeaways. First and foremost, regular ejaculation, whether through sex or masturbation, appears to be beneficial for prostate health. The research suggests around 5 times a week is optimal, but do what feels right for your body and your age. Don't force it, don't feel guilty about it. Just make it a normal part of your health routine, like brushing your teeth or taking your vitamins. Second, pay attention to warning signs. Pain, blood, changes in urinary patterns. These aren't things to ignore. See a doctor sooner rather than later. Third, support your prostate through lifestyle choices. Eat well, exercise regularly, manage stress, get enough sleep, and limit alcohol and smoking. Fourth, have regular checkups, especially if you're over 50. Prostate exams aren't pleasant, I'll grant you that, but they're brief and could save your life. And finally, talk about this stuff. With your doctor, with your partner, with your mates if you're comfortable doing so. The more we normalize these conversations, the more lives we save. Prostate cancer is one of the most common cancers in men, but it's also one of the most treatable when caught early. Don't let embarrassment or that stiff upper lip stop you from taking care of yourself. If you've got questions or concerns about any of this, leave them in the comments below. I read every single one, and I often make videos addressing the most common questions I receive. If you found this helpful, share it with the men in your life. Fathers, brothers, friends, they probably need to hear this information too. And subscribe to my channel because we're going to keep having these important conversations about men's health that nobody else wants to have. Remember, taking care of your prostate isn't something to be ashamed of or embarrassed about. It's essential self-care, and you deserve to feel healthy, confident, and comfortable in your own body at every age. I'm Dr. Amelia Wright. I've been doing this for over 25 years, and I'm here to help you navigate these issues with honesty, science, and a bit of British practicality. Look after yourselves, and I'll see you in the next video, where we're going to talk about another topic most people are too shy to ask about. What to do when things aren't working quite as well as they used to in the bedroom. Trust me, you won't want to miss it.